Hi, Dr. Myers. This is John Pastor from Idaho, and I appreciate your getting back to me so quickly. I just saw a 15-year-old girl that I'm a little uncertain of my assessment, and I wanted to run it by you.
Okay.
She's a 15-year-old girl who actually comes to see me with some abdominal pain, but recently a very close friend of hers was murdered, and it's been a very sensationalized case. But she comes in today very tearful and anxious, and actually stating to me that she's been seeing him sitting in his own car in front of her house. And, I've talked to her as extensively as I could, and it seems to me like it's probably bereavement that she's suffering, but I want to make sure she doesn't have some kind of PTSD or maybe some kind of even psychotic disorder. I was wondering if you could give me some guidance on the case.
Sure. Does she have any other symptoms of PTSD? Is she having bad dreams or flashbacks, or did she actually see him killed?
She didn't see him killed, and she said she's always had poor sleep, but isn't endorsing new sleep problems, no kind of nightmares.
And is she distressed by seeing him? Does it bother her?
Actually, she feels it's pretty comforting. And, she's going to get an ultrasound. We're thinking maybe she has a gallbladder problem. So we'll be evaluating that further.
Okay. Well, the one thing I can say is, of course, that recurrent abdominal pain is often a proxy for depression in kids. So those mild depressive symptoms you were talking about may indeed, along with this abdominal pain, indicate she has an underlying depressive disorder. I think you're right. The bereavement is probably the explanation for the hallucination or the altered perception. But she probably warrants a little monitoring for a little while to see where the depressive symptoms are going. I don't think you have to jump at anything in terms of medication or anything. Is she asking for medication, or is she asking for an intervention?
She isn't asking for an intervention. I feel like what she wanted most was to be able to share how she's feeling, and may actually benefit from having talked to someone about what just happened.
In your practice, do you have time to see